Okay, this morning I have Sarah Heenan with me. Good morning, Sarah.
Good morning.
I'm always glad to have you here. Sarah Heenan is the executive director of the UNC, let me get this right, UNC, I said it right a while ago.
UNC Nash
Heart Center. Well, UNC, they've changed and put UNC first now. So anyway, we have a great heart center, and we were just saying, I cannot believe this has been since 2014.
March 23rd will be 8 years old.
Oh wow, you know the day. You know
Yes,
the
I
very
do.
day. But established in 2014, and y'all have some of the most innovative cardiac catheterization equipment. There he is.
We do. This community is very unique in that we're about an hour from any tertiary facility. And so sometimes when you're having problems with your heart, you don't have an hour.
Mm-hmm.
And so we recognize the need for this a long time ago. I mean, it took probably about 10 years of planning for the Heart Center. And we actually do more, we take care of more patients with heart attacks than UNC Main Hospital. Last year, we took care of 98 people that were having heart attacks, and they took care of the low 70s. So when you think that they're an 850-bed hospital, and you know we're a 350-bed hospital, the need was always there.
Yes.
And so having the strategic vision to bring this to this community, you know, community hospitals usually don't have this level of service. They don't, because it takes a lot of resources, a lot of staff. And our executive team provided that vision. And I can remember walking into Larry Tuning's office, and I had a notebook that was probably 6 inches thick. And he told me to get what I needed for the Heart Center, and it had all the equipment that I wanted, and he didn't flinch.
Wow.
So we have a state-of-the-art heart center right here in this rural community. And there are people that are alive today because of this vision.
Yes,
so it's very exciting. I have the best job in the hospital.
I'm sure you do.
I do.
And y'all do stents. Let's talk about the service that you provide. You put stents in?
We do. We put stents in. The only thing we don't do is open heart surgery.
Right.
We've been putting stents in since 2010, but that was just elective. So the emergency work that we do, if you're having a heart attack and you know time is muscle, we can put stents in for that also. This year we're reaching out into more what we call EP work, electrophysiology, so pacemakers, ICDs, cardiac monitors. We're expanding those services here. We also just opened up a new service to take care of clots in your lungs.
Wow.
So with the same sort of technology, not stents, but it's actually an instrument that you can actually suck the clot out. And so that has been, before you would have to go, you know, somewhere else to get that done. So we have been doing that for about 6 months now too. So
explain, Sarah, if you will, when you say the word STEMI, we hear that word all the time from the medical professionals. What is a STEMI?
So you have 3 main blood vessels in your heart. So all the blood vessels come off these 3 main vessels. So obviously they're very important. So a STEMI is when one of these blood vessels is completely blocked. So it would be like 440, and it gets completely blocked, and then the traffic starts backing up. But the traffic can't go forward, so the blood can't go forward in this blood vessel. So all the muscle that it feeds, so it's bringing oxygen and nutrients to the wall of the heart, that wall is not getting fed. And cardiac muscle cells are very needy. And within about 3 minutes of not receiving oxygen or nutrients, they begin to die. And once they die, that's it. They form a scar on your heart. So obviously every second counts, because the quicker we can get in, the less heart cells are going to die. So that's why it's a flurry of activity and things get done very, very quickly. We want the time from the 911 gets to your house to the time we open that blood vessel. So all the things that have to happen in between, them assessing you in your house, them bringing you to the hospital, us getting you to the cath lab, getting in and opening the vessel, we want it to be less than 90 minutes.
Wow.
And right now we're staying right around 50. So
Wow, that's good.
it's a partnership. It's not just the hospital. It's EMS, all the EMS agencies in our area,
Right.
because they obviously have to get there quickly.
Yes.
We have what's called a code STEMI, so they will call it in the field. So the cath lab team will be waiting. Typically during the day, you don't even go to the ED. You get registered and you go to the cath lab.
Wow.
So-
Let me ask you this, Sarah. So somebody has they're getting a stent.
Yeah.
And it's a difficult, I know we have Dr. Prasada and some others, you know, and it's a difficult stent.
Right.
This collaboration we have with UNC, to me, is just so great.
Right.
Because you can have a team, whether it be 1 or 2 from UNC on a Zoom or whatever you call
Yes.
it, Teledoc, Zoom, whatever you want to call it, but they can be right there in the room.
Right. And I see that collaboration every day. First of all, we have 6 cardiologists. They're all UNC physicians, so they're UNC trained, and that gives a whole different level of skill mix here in the community. But they'll call their teammates and they'll doc halo them. They'll bring them into the room. They'll have them look at the pictures. What do you think we should do? So that kind of collaboration is also unique, in a community hospital. So,
Very good.
Yeah.
So there are other things that you do besides just stents, I mean, when it comes to the heart.
Yes. So I mentioned our EP work earlier.
Yes.
So, previous to this collaboration, if you needed a pacemaker, if your heart was not beating quickly enough, to pump the blood forward, you would have to go to another hospital. And, it's an hour drive.
Yeah.
And it's not just going to get the pacemaker, it's the pre-appointments, it's the post-appointments. And that transportation is difficult. And if you know Raleigh traffic, that's difficult too.
Yes.
And so having, we have a collaboration, not only we have physicians that do it in our own practice, but Rex comes here. And so Rex comes and does EP work here. Their physicians come. We also have a valve clinic. So between the chambers of your heart, there's valves that open and shut to let the blood go forward. And so these valves can leak. These valves need to be replaced, and so we have a valve clinic here where you can get all your pre and post work done here.
Right.
But you would actually go to UNC or UNC hospital to get the valve replacement. We don't do the valve replacement here. But there's a lot of pre and post work. It saves you probably 6 trips to UNC.
Wow, that is so good to know.
Yeah.
And now, y'all are big now with you've got a heart failure
We do.
concentration that you're...
We have a heart failure clinic. So when people hear the word heart failure, it's scary, right? All it means is that your heart is not as strong as it should be. So if you think about a pump, it pumps forward, right?
Yes.
With heart failure, the heart doesn't have the squeeze that it normally does, so it doesn't pump as efficiently. The blood backs up behind the pump, and you get swelling. You'll have shortness of breath. It's not comfortable, and so you often have to go to the emergency department. But in our clinic, you can come for 4 hours. We'll give you IV medicine that gets that fluid off. And then you go about your life, go shopping, have lunch after you go to your diuresis clinic.
We are so blessed to have this heart center. I mean, I don't know, I think it's the best kept, and I'm going to say secret because there's still people that don't know about it. But so much awareness has been created.
Right.
The hospital is really getting the word out. Patients are getting the word out. I hear testimonials all the time, Sarah, about how they went here locally and their life was saved because of the time thing. And they said everybody treated me. Everybody talks about the way they're treated in the heart center. how nice everybody is, attentive everybody is. So I just, we're so blessed, and we need to realize what we have with the Heart Center at UNC.
The other thing is we do a lot of community outreach. So if anybody wanted us to come and speak, we will be glad to do that because we have a passion for educating our community.
Yes.
And this community is often underserved and doesn't have the resources that it needs. And so we really want to get the word out. We have lots of people that would be glad to come to your function.
That's great.
And educate about heart disease.
Yeah, y'all just did that. We went over to the Y. Y'all just spoke at the Y.
That's right.
And, getting the word out. So, yeah, if any church groups, if anybody like that wants to hear a presentation, it's very important that we get this information. So, Sarah, so in 2019, y'all formed a kind of a relationship with, well, you had a relationship with Boyce Willis, but you kind of formed a collaborative with Boyce Willis in 2019 with the heart.
Right. Oh, you are talking about Dr. Prasada.
Yeah, yes, I think so.
So, in 2016, UNC physicians came to the hospital.
Okay.
And so we had 2 cardiology groups, which is fine. You can never have too many cardiologists. That's my opinion. But gradually over time, some of the physicians, the cardiologists at Boyce Willis, left for other, other opportunities. And so Boyce Willis actually reached out to us and said, could Dr. Prasada join your group, and then would you provide cardiology services at Boyce Willis?
Right.
So we have 2 practices now. We have one at Boyce Willis, and we have one on the campus of the hospital.
Okay.
So we have, it's grown and grown and grown. The need is so great in this community.
Right.
But that was just an example of a really good collaboration between, a privately owned clinic and then our cardiology practice. And it was the best solution to meet the needs of the patients at Boyce Willis and also the patients in our practice. So yes, we've enjoyed that collaboration.
Absolutely.
Yeah.
Well, Sarah, as I said, again, I can't say enough about our Heart Center. And if you want a tour of the Heart Center, I think they can contact you and just see.
They can call the hospital and ask for me. I'm certainly glad to arrange it. Obviously, I'm very proud of it. So I'd like to tour. If people, like I said, if people would like to reach out, if you need a speaker, we've got lots of people, not just me, that can come and talk to your community group and educate about heart disease. It's very, very important to learn about risk factors and what can be done and preventing heart disease.
Prevention is everything.
Prevention is everything.
If you can just prevent it.
Yeah. We were at the Go Red dinner last night, and we had a wonderful speaker who talked about women and heart disease and risk factors for women. And these are things people just don't know.
Right.
And so once they recognize the risk factors, they can do something about it.
That's exactly right.
You don't know what you don't know.
You don't know what you don't know.
That's
You're
right.
exactly right, Sarah, about that. So the hospital does recommend some general tips for healthy heart care. Exercise regularly.
That's right. 150 minutes a week.
150 minutes a week.
Okay. So, what I tell my patients is start slow. If you don't walk a lot, then walk to the mailbox.
Something is something.
Something is something, right? And soon you'll be able to walk to the end of the block, and soon you'll be able to walk around the block. I think that when people hear about these healthy tips, they get overwhelmed, right? Because it's such a change in lifestyle. But if you just start with little things, you can grow. If you can get to the mailbox today, maybe you can get a little further the next day. Healthy eating is very important. I'm going to highlight the work of the food pantry at Nash.
Yes.
So we're getting locally grown fresh produce for people that just don't have it.
Exactly.
There's areas in our catchment that don't have any access to healthy food.
Right.
And so
this is a great program.
It is a great program. It is a great program.
Really
the stuff in there is wonderful.
Yes.
And when you come to the hospital, if we determine there's a need, our community paramedics do the same thing. They're going out into the community and determine there's a need. We can get a food box from the food pantry.
Wow.
So wonderful new service at Nash.
Yeah, the paramedic program is also great.
Yeah.
It really is.
The community paramedics We refer patients that we consider high risk for readmission, because let's just face it, nobody wants to be in the hospital, right? So the paramedics will come to your house, they'll go over your medications, they'll assess you. If you have heart failure and you have increased swelling, they're going to call your doctor and say, what can we do to keep this patient in their home so they don't have to come back to the hospital? And it's, you know, it's a free service to our community. And a lot of my patients use the community paramedics. Just having somebody come to your house and say, let me see your pantry. You know, oh, this is healthy, this is not. Lots of education. So it's been a great journey. Started with 1, and now there's 3, and we're hiring another one. So, yeah, the program has really grown. We see hundreds of patients every month. So
another tip is avoid tobacco use.
Well, that is true. And, you know, Rocky Mount is a tobacco center, and it grew on tobacco. But if you think about your heart, the blood vessels in your heart are just like pipes. And what tobacco does, it makes those pipes very stiff. And it's very hard for blood to go through stiff pipes. And so it prematurely ages your blood vessels. So just as I said with exercise, you know, it's very hard to kick that habit. So I'll tell people, start with not smoking that cigarette right after you eat. Right. Start with doing that, and gradually over time you can just kick the habit, because it is a habit. You know, it's a habit. And so it's hard to break.
And we are creatures of habit.
Oh, I know we are. I know I am. But tobacco is something that really will age your blood vessels.
And then our weight. You know, we don't want to hear that word. We don't want to hear lose weight. But it's essential to maintain a good weight.
A good weight.
For your heart.
It is. You know, the heart is a pump, and the harder it works, it's just like anything else. The harder it works, the quicker it ages. And weight makes your heart work harder. And it also, additional weight increases your cholesterol, increases your chances of developing a blockage in your heart. So, like I said, start small. Don't eat dessert, right?
Oh, that dessert last night was good, Sarah.
I had to. I have to admit.
Well, it was berries to some degree.
Exactly.
So. But yeah, our weight and not smoking, and all of these things come together to, you know, make us have. It's just important to work to have healthier lifestyles.
Right, and it's not only quantity of life; it's quality, right? So we want to live to be 100, and we want to be doing cartwheels every single day.
Right.
So the better you treat this body you were given, the longer it's going to work, and the higher quality of life you'll have. So you just have to remember that that's the ultimate goal: is quantity, but also quality.
Right.
Yeah.
Thank you, Sarah.
You're so welcome.
I always enjoy having you on. Sarah is great, and the whole team at UNC Nash is just great. So, and in the Heart Center as well. So, anyway, we hope that you will take the tour if you've never been, or we hope that you will call and get your Sunday school class, your church group, your anything, one of your civic groups. Let them speak so everybody knows what we need to do to have healthier, as I said, healthier lifestyles, to live healthier lifestyles. And that's what it's all about. So thank you so much.
You're very welcome.
And we will see you back another time, Sarah. We
Anytime.
always ask for Sarah. But we love everybody else. We've had some of your other docs on too. So
that's right.
Anyway, we appreciate it. We'll be right back with you on the Live Morning Show presented by Don Bullock Chevrolet.